Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome everyone to our last session of the day. This is a health preparation guide if for anyone traveling for Hajj and Umrah. And today I have the honor of actually introducing a very close friend, a professional in this field of Hajj and Umrah, and also a professional in the field of medicine. He is a professor at Michigan State University for emergency medicine. And he is also one of those people that I personally reach out to for medical advice and for religious advice, especially when I'm there for Hajj. I've had the opportunity to perform multiple Hajj with him. He has been serving the community on the Hajj and Umrah side for 10 years now, volunteering, guiding groups. He is also a religious scholar as well. He has served as imam previously, and without any further ado, I would like to give it over to him so he can come and inshallah enlighten us with his knowledge from both sides, the spiritual side and the medicinal side, to guide us better on how we can prepare better for our Hajj, inshallah. So thank you for joining us, Dr. Bukhari. Whenever you're ready, inshallah.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Can you hear me, Harun?
Yes, we can hear you
Okay,
loud and
alhamdulillah.
clear.
Jazakumullah khair for that kind introduction. May Allah reward you and bless you. Harun is a gem for our community. He has been doing this for so long, and we always look up to him for guidance when it comes to Hajj and Umrah. And with all the difficulties now related to Hajj and Umrah, Harun has been there for the U.S. community, trying to make Hajj easier and better and more accessible. So may Allah reward you, Harun, your family, and Ainul Haramain and the team. You guys have been doing a great job through these difficult times regarding Hajj and its preparations and its organization. So, dear brothers and sisters, it's an honor to be here with you all. And as we prepare for this sacred journey, it is vital to remember that Hajj is not just a spiritual milestone, but it's something that's profound. It's a spiritual, not only a spiritual journey, but something so profound that it can also affect your physical undertaking. We essentially are preparing for not just a marathon of worship, but the rituals that involve this intense physical effort, navigating massive crowds, and then trying to endure that hot desert heat. Our goal today is going to be to try to ensure that when we come to Hajj, and specifically entering Mecca and Medina, we're not just going to be spiritually ready, as you have been going through this journey in these previous lectures, but it's going to be a physical and medical preparation. We need to prepare our bodies so that we can be ready for these acts of worship, so that we can appreciate also the health that Allah subhanahu wa ta'ala has given us. So we need to try to figure out ways now how we can prepare ourselves physically, mentally, reduce the fatigue, try to mitigate any injuries that can come on us or any stress, and so that we can focus on our worship and our ibadah. So, moving forward, Hajj and Umrah involves intense physical efforts. You're gonna see large crowds. You're gonna have very hot weather, and it's gonna be a lot of walking. Okay, you're gonna have daily episodes of fatigue, dehydration, and some of us may get infections. So we want to ensure that we're prepared so that we can have a good, healthy Hajj. So let's talk numbers. During Hajj, usually we are going to face physical activity that may add up to almost 5 to 15 miles every day. So when you consider Mecca and Mina, and when you consider all these other places, Mecca and Arafat, all of these total distances and each different station of rituals, There's going to be a lot of walking. There's going to be a lot of climbing, even. Sometimes people like to climb things, people navigating the crowds. So we got to prepare our bodies. We have to prepare um, injuries from preventing ourselves from getting injured or stress. So what we need to do is we need to begin now. And how can you begin now? One of the advices that we have is that start training yourself walking 30 to 60 minutes a day if you can. 15 minutes, maybe 20 minutes, start walking. Then start building that up to 30 minutes to 60 minutes of daily walking, gradually increasing your distances, using stairs whenever possible. You want to build that core and strength. The other thing that you want to do is if there's specific sandals that you have that you are going to buy or have bought, you want to break them in. One of the things that we see at Hajj is people bring these brand new sandals and they start blistering your feet. They're not worn in, so they start causing you a lot of leg pain, foot pain. So what you want to do is you want to break those sandals in now. And especially if you can start using some type of exercises that are stair-like exercises, that'll also help you strengthen your feet. The other thing that we do advise is that you want to make sure those sandals are waterproof and they're broken in. Why waterproof? Because a lot of times you're going to be sprayed with water or you're going to be doing wudu. And sometimes when you're cloth sandals, they can form a smell and bacteria. It's easier to clean waterproof sandals that you already have broken in. So those are some of the things that you want to start doing now. So you want to start strengthening your core, your quads, your hamstring. You want to start doing some balance exercises, especially if you're out of shape and you're older. If you're younger, you're in your 20s and your 30s, just building your stamina is important. But as you get older, you want to build that core strength as well. So you want to be cardiovascularly fit. You want to start exercising and just building that lower core. One of the other things that we do recommend for your health, and that goes for both parties, male and female, is that pro tip Vaseline. You want to have some Vaseline with you. You can get it over there as well, but if you bring it with you, that's even better. This is something that's a gem for every pilgrim. You want to use Vaseline or anti-chafing cream. What happens is because of the heat and sweat, your thighs will rub and they will start blistering. They will start getting abrasions and you'll start getting pain. And so then it becomes very difficult to walk because you can't wear underwear, especially in your ihram. Obviously, if you're not in your ihram, then no problem. But even then, most of us that are experienced in Hajj, we tend to use a lot of Vaseline or a lot of protective layer in between. And we make sure that obviously it doesn't have any smell in it, especially those sweating areas that we're prone to. That'll help prevent any blisters, any burns, any chafing. So the other thing that you want to do is you want to prepare yourself medically. You want to go to your primary care physician, your doctor, and you want to start getting your appointments in now where you're up to date with your vaccines, your chronic medical conditions, if you have any, high blood pressure, diabetes, your cholesterol, or if you have any autoimmune issues, or if you have any heart failure, or if you have any edema, any chronic medical conditions, kidney issues, if you need dialysis, these things you are getting ready for it now. You want to get medical clearance, especially because the demands that a pilgrim goes through is intense, and if you're not bringing a family member with you to help you, it is very difficult. There's just so many people and not enough staffing to really help you through these, issues. And so a lot of times you may be on your own and you may be relying on the system's medical facilities, and that's a challenge in itself. So make sure that number one, your vaccines are up to date, especially the meningitis one. Why the meningitis one? Because you're going to be with a lot of people in a small area. And that's when you're more prone to meningitis or a virus infection that causes you headaches, fever, chills, body aches, fatigue. So meningitis is very important. Obviously, if you have some allergy or you have, some reaction to vaccines, then you have to get an exemption letter, okay? Then you want to get some of your boosters, your influenza, you want to get some of your the pneumonia vaccine. Those are important to get because a lot of people get the flu, a lot of people get pneumonia on Hajj, especially that Hajj cough, as they call it. So these things will help you kind of reduce the risk of it. That doesn't mean you're not gonna get it. No, sometimes you get it, but it's very mild. It's better than getting it when it's severe, especially like COVID. So depending on your travel, and where you're coming from, and usually in the US, we don't need to worry about yellow fever or polio, but you should be up to date with those as well. Okay. So you want to manage your chronic conditions like diabetes, blood pressure, seizures. People get a lot of seizures and need medications for this. So you want to carry a good amount of prescriptions with you in your original packing, and you want to have a formal medical letter from your primary care physician with a letterhead stating what conditions you have and what medications you need for them, just in case you get issues at the border, just in case you get issues when you're screened, or just in case you get issues when you're at Hajj from security and whatnot. We had a few cases throughout the years where people had mental health medications, people had chronic pain medications, and this became an issue for them, and we had to help them and intervene because they didn't have some of these documentations that they needed for this. Okay. With diabetes, you got to be careful because there's a lot of physical exertion. And if you have neuropathy, you have numbness and tingling in your feet, if you have decreased sensation in your legs, you're more prone to getting injured, blisters. And if you have diabetes, you're more prone to getting infections. So that's something that you have to be very cautious of and very cognizant of. Okay. The other thing is with your insulin. If you have insulin, you want to place that in cool places. You want to have a portable patch or cooler or something like this that you can carry with you. You want to have snacks with you so that just in case you get hypoglycemic, because you may not want to eat certain times, and you're sweating and it's a lot of heat. Although they have made very good accommodations now, whichever package you're in, they have made very good accommodations to combat the heat. So these are something that you want to be aware of, okay? With your blood pressure, maybe having a portable blood pressure cuff, that's nice to have, a portable sugar test, but nothing bulky, something very small and light that you can take with you. And during this time, you want to also avoid, some of these high salty foods, and some of these things. So let's see here. So consult your doctor, have your full medication list, avoid. So the other thing that we recommend to avoid some of these complications, because they make good Hajj preparation, is during the peak times of the heat, you don't want to go out, 11 a.m. to 4 p.m. You may feel like you're missing out, or what is that called? FOMO, right? Everybody gets FOMO, fear of missing out. But don't worry, you won't have any fear of missing out. Just try to avoid going out during these times. If you need a wheelchair, please contact Harun and the Ithara team, or any team, whichever team you're going with, whichever group you're going with, so that they can prepare that. It's not easy, but if there's good preparation, you can get the wheelchair. And if for whatever reason you forgot, or you didn't prepare for it and you were able to get it, you can always go to the local pharmacy and get a wheelchair. During the rituals, you want to make sure you get good rest. You want to always stay with your group leader and always get their advice if you want to try to do something or go away from the group or try to venture out on your own adventure. Always stay with the group. You don't know how many times Harun and I have been called to find somebody because they left and now they have heat exhaustion, they passed out, and they're in the middle of nowhere in Arafat and nobody can find them. They don't have their phone with them, there's no GPS tracker, and now you're in the situation. So always get the advice of your group leader. Stay hydrated regularly. So we talked about some of the vaccines, meningitis, COVID. It's up to you about the COVID vaccine. I know there's different data and there's different reports coming out. It can always help, and sometimes, if there's side effects, so it's up to you about the COVID vaccine. Influenza and pneumonia for sure.
Dr. Bukhari, I'm sorry I'm disturbing, but we had a question in our sessions earlier in regards to meningitis. Someone asked when is the recommended time to take it. So if you can just, I know you covered the vaccines already, but if you can just give some details on that before we proceed ahead.
Absolutely, yes. The best time to take the vaccine is at least 10 days before you arrive. The earlier the better, but that's the least time. So like if you can get it now, great. But at least 10 days before Hajj. Why? Because just in case your body gets used to it, you get the effects of it. If you get sick from it, because sometimes you do have a reaction, a response. Your body is, building antibodies and trying to get prepared for those types of infections. So at least you want to do it 10 days before you arrive to Hajj, and that's the best time. Even if it's 5 days or whatever, it still can help, obviously, it still can help. So that's the best time for that. Oh, some of the other things that we want to make sure of is your asthma, COPD. Okay, a lot of people smoke, they get chronic bronchitis. People have asthma. This will and may get triggered by the AC, maybe by the heat, the virus infection. So one of the things we recommend is that making sure you have a portable nebulizer machine or your inhaler, okay, and have an extra inhaler. Worst case scenario, you know, you can always go to the Hajj ministry clinics, get a prescription, and then go to a pharmacy and get the inhaler or solution for the nebulizer. But if you have your own portable nebulizer, they're very small, great technology. That's the best thing, especially if you have severe asthma, COPD, chronic bronchitis, these types of things. So you want to keep that with you. All right, let's continue on. So some of the things that are related to Hajj and Umrah and the health risks. So one, you have to understand you cannot control the crowd. Nobody can control the crowds. Nobody can control education levels of people. You have to understand one thing. If you're coming from the United States, you have a different level of education. You have a different level of understanding of health concerns than the rest of the world. That means you have to be more understanding, more merciful, and you have to take the precautions. You can't expect people to take the precautions coming from other countries from all over the world. They just don't have that. They just don't have that in their community. So you're gonna get outbreaks. There's gonna be infections. People are gonna be coughing. You have to control what is in your heart. You have to control getting angry. A lot of times we get upset if somebody sneezes or coughs in front of us, and we expect them to have that understanding. But no, it's not like that at Hajj. And other thing that you have to understand is a lot of times people from the United States are younger. You're going to be dealing with elderly populations, elderly communities that have been saving their entire life to go do Hajj. And now they're there. They don't care about anybody. They don't care. They're there. They're going to do their Hajj, whether they're sick or not sick. And it's amazing. It's actually an amazing sight to see. But you coming from, the Western, as they say, the Western civilization or whatever they say, you coming from these different countries, you have to be more understanding. So the other thing that you have to understand is you're going to get hit by wheelchairs. You're going to get hit by umbrellas. You're going to get hit and you may get injuries. Just let us know, especially if I'm there with you and Harun is there with you and our team. Just let us know so that we can help you try to figure that out. The other thing is sunburn, dehydration, heat exhaustion. These are real things. I have seen people have heat strokes in front of me. So you have to be prepared. You have to avoid the heat as much as possible. Have an umbrella with you, have a bottle spray with you, have some water with you, have some non-scented sunburn cream with you, and then try to avoid dehydration, okay? Food and water. Diarrhea is something that can happen, especially if you don't control your diet. You're going to see buffets. Now they've made it very nice. You're going to see all kinds of food. And a lot of times, because of the heat, they've been sitting out. My advice is try to eat fresh food that's cooked daily and that hasn't been sitting out for a long period of time, and try to eat like as if it's Ramadan. Try to eat as if it's Ramadan. Try to eat least amount of possible that gets you by. Don't go just eating this huge plate and then you're gonna feel sick. I'm telling you. So try to avoid that. And we have talked about the infections and whatnot. So if anybody has any questions, just post it on there. So then Harun will communicate this with me. So fatigue, dehydration, some of the signs of, so you should know this, some of the signs of fatigue and dehydration: diarrhea, vomiting, fever, you're peeing a lot, you're urinating a lot, you're excessively sweating, you're getting tired, you're feeling worn down. You're like, man, I'm so tired. What's going on? Even though you're healthy, that may be a sign of dehydration. Okay. So take with you electrolytes, IV liquid. There's all kinds of things now. Emergency, IV liquid, hydration. It doesn't matter what it is. Gatorade powder, something light, something portable you can take with you, put into water, and then you're on your way. Drinking small amounts of water every 20 to 30 minutes is great. Aim for about 2 to 3 liters a day, but also understand you're going to have to use the bathroom too. So prepare yourself mentally. Getting to the bathroom is not easy, especially when you're in the haram or when you're doing the rituals of Hajj. So you have to mentally prepare yourself. If I'm drinking this much now, I got to make sure I use the bathroom before I leave. Or how long will it take me to get to this location? Will I have enough time to use the bathroom? It's very difficult. Use electrolyte drinks when you can. Avoid too much caffeine because that can make you want to use the bathroom and dehydrate you. So try to detox yourself from caffeine if you can. A little bit of caffeine is okay, but understand that caffeine comes with side effects. Here's a great slide that shows you about the amount of kilometers that you may have to walk sometimes, depending on the Hajj package that you have. Makkah to Mina is about 8 kilometers. Mina to Arafat is about 14 kilometers. Mina to Muzdalifah is 3 kilometers. Usually, we don't walk these. We usually take a bus, or you're going to take a train, but you're going to be with your group. But there are some people that are adventurous and they want to walk it. Our advice is, it's okay to maybe walk from, Mina to Arafat. Actually, honestly, we don't recommend walking, but it's too hot. It's too difficult. But you still have people that walk. And generally, the time that people really, really walk is from Muzdalifah back to Mecca. Muzdalifah back to Mecca. So you can imagine that's about 15 kilometers in total. So that's not easy. That's not easy, especially if you're not prepared. But we don't recommend walking. It's too difficult. Just stick with your group. Stay on the bus or stay on the train. It's not wise during this time. So here's a map depicting that. So here, can you see the mouse, Harun? Can you see that mouse? Yeah, okay. So you have Mecca to Jamarat is about 7 kilometers, 4.3 miles. Then Mecca to Mina, look at this. It's about 5 miles, 5.5, 6 miles. From Mina to Arafat. Then
You can
Arafat.
use the brush feature within the meets so they can see it, because they're not going to be able to see the mouse.
Yeah.
There's a little stroke thing that they have within the presentation. You can actually mark the presentation with that.
Yeah, go ahead. Why don't you do it? Why don't
I
you
got
talk about, just mention it real quick.
All right. So going from Mecca to basically Mina, we're looking at about 9 kilometers over here, approximately 5.5 miles. And then when we move to Arafat, you can see over here it's about 7.75 miles. I'm sure everyone is more used to miles and just going to cover the miles. And then from Arafat going to Muzdalifah, you have about 6.5 miles. And as Dr. Bukhari was mentioning, most people, they actually start walking from Muzdalifah They'll go to their tents, they'll restock on water and drinks or whatever you need for your route to walk actually to Jamarat. And then from Jamarat, they will head straight to Haram, which is about 4.3 miles from there. So in total, that will be about approximately about 8 miles. If you do the whole walk from Muzdalifah to Jamarat, and then from Jamarat, you're heading to Haram to actually get done with your Tawaf Ziyarah.
That 8 miles that Harun is talking about from Muzdalifa back to Mecca, that's like almost like 10 miles. Like it's not easy. It's not an easy 8 miles. And the reason why people end up walking it is because it's too difficult on the buses or on taxis to get to Mecca. It's too difficult. You don't have enough time waiting around. Nobody's going to help you in that situation. They did start doing these Mecca buses, which are okay, but it still takes a few hours on those Makkah buses, almost better and easier to walk it. So if you are young and you have the health for it, this is something that we do sometimes recommend, that it's almost easier and better to walk it to perform your rituals than to wait around. It's just unreliable because you have millions of people doing the same thing. You have millions of people doing the same thing. But these other locations, when you're going from Muzdalifah to Arafat, or when you're going from Mina to Arafat, these things, it's better to stay with the bus because it is prepared, it is organized. Okay. So heat exhaustion, this is something that we need to cover. This is important because if you're at heat exhaustion, then you're at risk for heat stroke. And heat stroke is not good. So heat exhaustion is when you're dizzy, you feel thirsty, sweating, nausea, weakness. You want to right away move into a cooler area. Let us know and just take a break. Just rest. It's okay. Everything will be okay. Your Hajj is going to be fine. Nothing to do with your Hajj if you take a break and you just rest, even if it's 24 hours. But when you get to a heat stroke, you start seeing somebody with you in our groups, you start seeing them confused, dizzy, lightheaded, they're passing out. That's an emergency. You got to let us know. Let the workers know so that we can get you to the hospital, get you maybe IV fluids, or get you in a cooler area and see if we can, turn this around. So this is something that's an important slide that I want you to review when you're reviewing this lecture. This will be available to you guys too. So avoid the crowded areas, avoid the excess heat, keep hydrated, keep an umbrella with you. Heat stroke is something that's real and it does happen, but usually we see this in people who are unprepared or elderly and they're trying to do too much. Moving on to pregnancy, Hajj and Umrah. Honestly, if you're pregnant and you're in your later stages of pregnancy, we recommend you postpone it. It is difficult, but we have seen people do it and get through the security checks and customs. So if you're going to do it, understand that there's always risk associated with it. You can get maybe preterm birth, early miscarriage. You can develop preeclampsia, which is a condition in pregnancy that causes a lot of swelling, blood pressure, headaches that can become dangerous to the baby. You can develop gestational hypertension or diabetes, which is pregnancy-induced high blood pressure. Pregnancy-induced diabetes can affect your kidneys. Dehydration is a real thing. You got two things inside of you that are trying to take your energy, and so dehydration in pregnancy is real. You can have a risk of bleeding. It becomes high risk, but we've seen people do it, and it should be something you should discuss with your doctor and with your Hajj guides, okay, before you go. Something that's every person is different, okay. So the other thing that we want to talk about is your menstrual period, birth control. I know Sister Farhana had spoken about this in detail. The lecture will be available to you guys. Please contact Harun and look at the Ainul Haramain portal. The lecture is on there where she went into detail about Hajj and females, and this was included in it. But in the end, talk to your doctor. If you calculate and you're regular with your periods, and you calculate that during Hajj you're going to have your period, you want to talk to your local imam right away, and you want to talk to your doctor right away to see what options you have, because it may affect your Hajj. And then you want to know what you need to do depending on when your period happens during Hajj. It's not all one flavor. Everybody's different. It depends. Did you get your period when you arrived? Did you get your period after you performed the Umrah? Did you get your period when you were at Arafat? Like, it really depends. So if you calculate it out in your regular, plus or minus 1 or 2 days, and you're falling during the times of like Arafat, or Mina, or you're going to leave before your period ends. These are important things that we need to know, that you need to know, that you need to talk to your local scholar, your local imam, and try to talk with your doctor so you can plan out the birth control and contraceptives. But all of this always comes with side effects, right? Birth control always has side effects that you should know, and most women know about that. And then obviously Motrin, you should know this. Motrin, Aleve, these things help when you are on your period. They help decrease the bleeding, and they help with the pain. This is only NSAIDs, non-steroids, anti-inflammatory medications, which are Motrin, ibuprofen, Advil, Aleve, these types of things. So if anybody wants to talk about birth control, I'm available. This is, this is something I do on a daily basis. I can help you through it, and with Hajj and Umrah. Just let me know, contact Harun, and we can talk to you individually. But here's some of the side effects with birth control, and then there's different types of birth control. I won't get into that, but if this applies to you, you can contact us, okay? And we'll help you through this. And then here, this slide talks about the different types of birth control. The 28-day pack, where you take it for 21 days, and then you have the 7 days break, and then you have your periods. Generally, you would skip the 7-day break, and then you would continue taking the birth control to help prevent your periods. But understand, you can still have breakthrough periods. You can still have bleeding on the birth control. Does that count as a period? It's a difference of opinion, but generally no, especially if there's just spotting and it's not actual bleeding. But anyways, we can get into that. But if you're going to do it, you want to start now. This is the time to do it now. Otherwise, it's going to be too late. Then there's a higher risk of bleeding. Okay, higher risk of bleeding. That doesn't mean it's not going to work, but there's a higher risk. So option 2 is the progesterone only. I don't recommend that. It's not good. Progesterone only birth control is not good at all. There's a lot of side effects with it. I have rarely seen it be actually effective. So just so you're aware that this option is there, and if your doctor recommends it, I wouldn't go with that route. And then here, I want this slide to be there for you and available, and it's pretty self-explanatory that this type of birth control, we call it NET or norethindrone. These can help a lot. These probably work better, but something to talk to your doctor about, or contact me. Inshallah, we can talk about it. All right, moving along. Breakthrough bleeding. Okay, we'll keep going. Some of the common conditions some of the common things that you are going to see at Hajj that you may experience, or you may see somebody experiencing: upper respiratory infection, bronchitis, aka the Hajj cough, okay, stomach flu, gastroenteritis, food poisoning, diarrhea, issues like sunburn, infections on the skin, cellulitis, dry eyes, itchiness, the heat exhaustion, dehydration. These are some of the environmental hazard things that you may experience. So you want to go to your doctor and ask them to prescribe you medications, okay? Your blood pressure medications, make sure you have them with you. Avoid salty foods. Eat in moderation. Take an aspirin with you if you have some heart disease. With diabetes, make sure your insulin is in good condition, and that you have preparations to store it. Avoid sugary foods. You're going to see a lot of sugary drinks and sugary foods. try your best to do it in moderation and very, very lightly. Um, when it comes to bronchitis, have your inhaler. Make sure you tell your doctor to give you like a Z pack or a doxycycline or augmentin. Amoxicillin is not good at Hajj. You want to use augmentin, the other form of amoxicillin. If you're going to get medicines to take with you, take augmentin, not amoxicillin. Take zithromycin, the Z pack. Those are better um, if you want to take some antibiotics with you. Then you want to take some allergy medications, Claritin, Zyrtec. Some of the awesome thing about Claritin and Benadryl and some of these other medicines, they cause urinary retention. It's a side effect. So what that means is that it makes you want to go to the bathroom less. So sometimes I personally will take a Claritin and that'll help me not to use the bathroom as much, even though I still need to go, but I'm able to control it better. We talked about asthma. We talked about seizures and epilepsy. Make sure you have your medications, leg swelling. This happens a lot to a lot of people. You bring aspirin with you. If you have this as a chronic condition, make sure you bring your water pill. Make sure you have compression socks. Although during ihram, you cannot wear it. Uh, Outside of ihram, it will help you. Now, if you have this issue, or you have somebody in your family that has this issue where they have chronic lymphedema, like swelling in their legs. Honestly, if you have to wear it during ihram, it's okay. It will help you pay the dam. You're going to have to pay a sacrifice or some type of charity, and we'll help you figure that out. But if it's so bad where you can't walk and it's affecting your health and you have to wear the compression sock, honestly, when it comes to medical health conditions, there's always a exception, but it comes with a sacrifice or a charity. Kidney dialysis, end stage renal disease, this is serious, right? You need to let us know now, like you need dialysis or you have portable dialysis or you have kidney issues, because going to Hajj then is very difficult and very dangerous at times, and we need to prepare that for you to help you prepare that. And a lot of times you won't be able to prepare for it, right? But that's why then we recommend you take the high package. You take the VIP package, the $20,000, the $25,000 package, because you're just not going to get the care that you need in the lower packages, and it's going to cause a lot of problems for everyone. So this is something that you want to talk to Harun about right now, or your Hajj group. Talked about the bladder issues. If you have you got to use the bathroom a lot, antihistamines help. Make sure, honestly, if it's a problem, just wear a diaper. Who cares? Just wear a diaper and just pay the dam, pay a little penalty. At least it'll help you do your Hajj, Foley catheter, this is a rukhsa. AMJA has a lot about this, the American Jurist Association, your local imam or whatever, whatever you follow, talk to them about having a Foley catheter if this is applicable to you. Smoking, obviously this is difficult during Hajj. If you have a smoking addiction, you want to start quitting now. Take nicotine patches with you. They're over the counter. Sometimes certain medications can help with smoking. This is the best time to quit. It's going to cause issues for people around you. You're not going to be able to smoke. I'm telling you right now, there's a lot of security there too, a lot of Hajj rules. You're not allowed fire things in the tents, and becomes a fire hazard. So, and then you end up paying a penalty with the ministry. So you got to be careful. Try not to smoke. Anxiety, panic attacks during Hajj. This is real. A lot of crowd, a lot of claustrophobia. Be wise. You're gonna have to try to be wise and patient. If you need medications, ask your doctor to take it with you. Sometimes we recommend magnesium. It really helps for this. Melatonin if you have sleep issues. If you have crowding issues, there's nothing you can do about it. There's not much, because Hajj is Hajj. But if you have the money and the wealth and you are claustrophobic, then we recommend you go with the VIP package, the 20,000, 25,000 Kitana package. That'll make it easier for you if this is a serious issue, a serious problem. Otherwise, there's nothing you can do to control that. You just have to be wise, keep your distance, and try your best. You're gonna get bumped. You're gonna be around a lot of people. You just have to be patient. So in pro tips and to coming to a summarize for the topic, Vaseline is your best friend. Unscented soap is important. You can always get it over there, especially in Bin Dawood and some of the grocery stores and the local grocery stores. They have Vaseline. They have unscented soap there. That's the wise way to go. You want to start conditioning yourself now. Start walking, physically prepare yourself, especially your core. You know the legs. It's very hard wear and tear on your lower extremities. It really you get aches and pains. Avoid eating fast foods, heavy foods, fatty foods. Eat light, get comfortable walking in your sandals. Again, these are pro tips. These are the things that we've experienced over so many years. You know, breaking in your sandals, getting good sandals, investing in sandals, literally like $100 if you have to, is worth it. If you buy the $5, $10 sandals, it's not worth it. You know, I remember our elders used to say in Urdu, you know, they used to say, Manga roy ek bar, sasta roy bar bar. So the translation is, you know, if you buy something that's good quality and it's a good price, you may cry only one time about the price. But if you if you buy something cheap and it was low quality, you're gonna keep crying over and over and over and over. So take antihistamines with you. Make sure you have backup glasses. If you have really poor vision, make sure you have a backup pair of glasses. You don't know how many people lose their glasses during tawaf. They break their glasses accidentally. Make sure you have an extra pair of glasses, especially if you have poor vision, or contacts with you, disposable daily contacts. When you go out and you're not in ihram and you're doing tawaf and you're seeing the different places, the mazarat, you know, you're doing tourism. One of the things we recommend is that when you come home to your hotel, you have your hotel clothes. And then when you go out, you have your outdoor clothes. You know, you change, you switch. You don't keep on the same clothes in your bed, or you go to sleep in them after you've been out in tawaf with all the germs, with all the coughing and congestion. What in ihram, you can't do anything about it. You know, you can change your ihram. It's allowed, it's permissible to wear another ihram, but most people don't like to do that. That's okay during ihram. But outside of ihram, when you're in Medina, when you're in Mecca, and you're outside of ihram, change your clothes. Keep one pair of clothes for your hotel, then another pair of clothes for outside. There's a difference of opinion about alcohol sanitizer. It doesn't have a smell. It's okay to use it. Everybody's different about it. If you're really worried about it, just pay a little bit of charity. Um, Always take precautions when you're coughing and congested. Medications that we recommend to take with you. Okay, so we talked about the antibiotics. You want to have azithromycin or augmentin or some of the doxycycline, these types of medicine. Cipro, Flagyl, these are good for the diarrhea or gastroenteritis type, you know, stomach issues. Tylenol, have a little bit of Tylenol with you. Have a little bit of ibuprofen, Motrin. You want to take some Imodium for diarrhea. Pepto-Bismol can help. Something small. You don't need to take the whole bottle, but you just, if you have a little bit with you, that's good. Take some contacts with you if you have eye issues. Inhaler, nasal spray, vitamin C. Vitamin C is very important. You want to keep your immune system boosted. So there's so many different types now. It's up to you. Whichever one you like, whichever one you use, just bring some packets with you. We always end up sharing with each other. We always give each other electrolytes. We always keep each other hydrated. This is good to have with you. Something very important. Cough medicine, cough drops. This is good to have with you. It really does help, you know, if you end up getting that Hajj cough. So these are some of the medications that we recommend, okay? The slide is here. You can take a look at it. So we mentioned some of these medications. Steroids help, especially if you have chronic autoimmune issues, bronchitis, asthma issues, skin issues. You want to take some steps. Zofran. I can't emphasize how important this is. If you're a person who throws up a lot, gets nauseated, especially motion sickness, you have a lot of motion sickness, tell your doctor to give you Zofran or Odanastron. That's the other name for it. Okay. So these are some of the most important medications you do want to have with you. If you're a healthy person, you don't need to have this. If you travel and you end up not using medications, it's okay. We'll have medications with you. You can always go to the clinic. We can always go to the pharmacy and they can help us. But when it comes to certain medications like antibiotics or certain specialty medications, you need a prescription for it. If you have a prescription from America, they'll take it. But if you don't have a prescription that's like official prescription, then you have to go get one from the local clinic at Hajj and Umrah Ministry, and then you take it to the pharmacy and they'll give you the medicine. It's not like the old days where you went in there and whatever medicine you wanted, they'll give it to you. No, it depends on the medicine now, and they're very strict about it, especially during Hajj and Umrah. So emergency information, any issues, let us know. Let the Hajj groups leaders know. Let the local workers know that you need help, that this is happening. Try to ask people where's the local, every tent, every region, every area in Mina, in Arafat, in Muzdalifah, in Mecca, in your hotel, near your hotel, there's local health clinics set up. You just got to know where they are if this is something that is going to be applicable to you. Okay. Emergency numbers. There are emergency numbers. Here it is. Here, general emergency is 911. The ambulance is 997. Don't don't expect that when you call they're gonna be there right away. It's always a hours of delay. There's just so many millions of people. So sometimes, it's better to let the group leader know so they can help you and just either take you there or assign somebody to help you and take you to the clinic to get you that help that you need. We don't really talk about this, but this is important that you should be aware of. Sometimes we forget that. What about after Hajj? What about after the Umrah? What are the things that we may experience? I'm going to put the slide here. Maybe with Ainul Haramain, we'll do another post-Hajj lecture or a post-Hajj get together and we can talk about this. But something that you should be aware of is that when it comes to your cough, fatigue, Hajj blues, that's real. People actually go through postpartum Hajj, if you want to call it. They actually go through Hajj issues where they're depressed, they're anxious, they feel down. This is real. This happens, and that's just part of Iman. That's part of your faith. And that's a part of that change that's occurring within you. One of the signs that you had a good Hajj, that your Hajj may be accepted, is that you have this feeling of longing. You want to go back. You feel sad. You feel like you miss it so much, and that's a good thing. But that is real. And then you want to talk to your local imam, talk to your friends that are spiritual to help you through this. Try to be with people. Antibiotics is important because you're gonna get sick. Especially getting sick after Hajj, that's a good sign. Any illness, any disease, any sickness that we go through is a means of Allah wiping our sins away and elevating us in ranks. So Tylenol, Motrin, cough medicine, vitamins, important. Okay, so final advice, guys: prepare yourself physically, stay hydrated. Okay, prepare yourself not just physically but mentally, emotionally, and spiritually. One of the best ways to get a good Hajj is to clean your heart, clean your mind, okay, and prepare yourself physically. You have to clean your heart, remove the grudges, and this affects your mental health. Okay, if you're holding on to a grudge, if you have a lot of animosity towards somebody, do you have family dynamics, family problems, this is the time to solve them. And that doesn't mean that you just go back to being normal. No, sometimes what we're saying is that, you do have problems with people, but you want to keep a distance from them, but that doesn't mean you want to hold a grudge in your heart. Sometimes they've done some you harm. That's understandable. You want to clean your heart. When you're going to Hajj, this is not about them. This is about you and your relationship with Allah subhanahu wa ta'ala and your akhirah. A Hajj that is performed with no grudge, no anger, no animosity, no arguments, and you complete the rituals, this is a Hajj Mabrur. This is a Hajj that may be accepted. When your mind, your body, and your soul are clean and they're spiritually sound. Qalbin Salim. This is what Allah subhanahu wa ta'ala says in the Quran when Allah subhanahu wa ta'ala says, يَوْمَ لَا يَنْفَعُ مَعْلٌ وَلَا بَنُونَ إِلَّا مَنْ أَطَى اللَّهَ بِقَلْبٍ سَلِيمٍ. That on the day of judgment, not your wealth, not your children, nothing will benefit you except a person that comes to Allah with a sound heart. And one of the qualities of a sound heart is it's clean. It has no grudge. People will do us wrong. You can forgive, but you may not forget. That's okay. You know, hurt me once, shame on you. Hurt me twice, shame on me. Right? A lot of times, let it go. It's not worth it. Just let it go. I know there's dynamics. Let it go. Stay hydrated, get the rest that you need, maintain the hygiene, prepare yourself emotionally and spiritually. Start listening to lectures, spiritual, whatever moves you. Okay? Everybody's different. Some people get motivated by listening to a lecture. Some people get motivated by going back and forth to the masjid. Some people get motivated by doing muraqabah and meditation, salah. Some people get motivated by taking time off work. Whatever it is, whatever moves you, you need to start doing it now, because that's going to be with the best Hajj that you're going to have, inshallah. All right. Any questions? Any concerns? Any last minute, DJ Harun, if you want to chime in, if you want to say anything.
Yes. If anybody has questions, please feel free to post it in the chat. In the meantime, I'm just gonna add a couple of things over here. First off, Jazakallah khair for doing this presentation for us, Dr. Bukhari. And there are multiple things that you do need to consider when you are traveling, especially with chronic conditions, and make sure you are prepared. We cannot say this enough. We cannot advise this enough. Preparation is the key to Hajj. Because when the time for execution comes, when we are actually doing those long walks, and you decide to go from your Mina camp all the way to Haram and walk in that 8 miles, you want to be prepared in a way where you don't feel any of those things. We want to keep the questions related to today's topic, but if you have purchased your package already, you should be receiving your visa and ticket in your email. And if it's not in your email, check under your Nuzuk account. It should be in there. So continuing on, even for the medical services and all these emergencies that happen, I want to talk about something specifically to some of the topics that were covered today, and I'm just going to share some real life examples. One of them, there was a French female Haji with another group. I wasn't involved with that, but they were in the hotel that I was assisting Itra Al Khair with, and she was claustrophobic. And her claustrophobia was only related to elevators. It was really weird. And a lot of these 5-star hotels, the rooms actually start after sometimes like the 15th floor, 16th floor, 17th floor. So you have like floors that are just for like maintaining things in the hotel. Then you have multiple restaurant floors. It's like 5, 6 floors. So we had to actually work with the hotel and the team and everything to figure out a way for her to actually walk all the way upstairs. And I ended up walking with her for I think it was about 20 stories high, and I gave her the lowest possible room that we could have given her. So floor 1 for the rooms was 20 floors high. So these are things that our team is there to help and prepare and everything. But if you have issues like maybe issues with elevators and stuff like that, I would suggest try to slowly wean off of it, so at least you can handle it for at least one trip up and down. Because she basically just left once to go do her umrah. She walked down, she walked back up, and then she went for the Hajj days. So doing the rituals, okay, you can climb up those 20 stories, but at the end of the day, like, to make your life easier, it's always better that you prepare yourself a little bit better. Dr. Bukhari, we
Well,
have a question towards you. I'm gonna
yeah,
jump to
yeah,
the question.
yeah,
Uh,
sure. I
for
got it.
how long is the meningitis
I
vaccine
can see
valid?
it. I can see it, Arun. Yeah. So the question is, how long is the meningitis vaccine valid for? About 5 years. Okay. It's valid for about 5 years. After that time, you want to get a booster or another vaccine injection for it. And they do check this. Make sure you have a letter from your doctor of when you got the vaccine, or some official or some professional form of document like your MICR, MICR, that's to say your immunization record, whatever it is you have in your state. Make sure you have a copy of that. It can be on your phone too. That's okay. A copy of it on your phone, a paper copy, somewhere you have a copy of your immunizations where it shows the date of when you got the vaccine. They sometimes do check this. They sometimes do check this. So valid for about 5 years. The second question here is, can you use lidocaine patches or diclofenac cream for pain in the state of ihram? In general, when it's for a medical reason, it's okay. However, we recommend during the state of ihram, you try to avoid it. But lidocaine patch, if it's absolute necessity, I would avoid anything patchy during ihram unless it's like absolute must. It's better, in my opinion, when it comes to pain, to take the pill. You're Guys, listen. Ihram, the state of ihram, is only during for the Hajj is only during 3 days, and then depending if you do Umrah. Umrah is like a few hours, no big deal. Okay, you don't have to worry during the Umrah part. But when it comes to Hajj, it's the 8th, 9th, and 10th, 3 days. 3 days, if you can avoid using some of these patchy type things, cream or these types of things, that's okay. But we still recommend avoid it. If it's related to pain, just take the pill. Just take Motrin, ibuprofen, Advil, Tylenol, to avoid having to pay a charity or any doubt or whatever you have it. But in general, medical reasons, no problem. Just give a little bit of charity. Do you recommend bringing energy drinks like Celsius? Sure. I'm a big fan of energy drinks in moderation. I know sometimes we just need it. Some of you guys are like energy drink crazy. If you want to bring Celsius, it can help, especially if it boosts your mood up and all that stuff. But remember, you got to stay hydrated on energy drinks, because when you're sweating, the heat is there, and then you're doing energy drinks, you're going to get more tachycardia, heart racing, anxiety, palpitations. So you got to do a balance there when it comes to the energy drinks. Okay. But yes, I understand. Some of us, you need that energy booster to make or break, your time. So I get it. It's important. Someone who has pounds, who have IBS with anxiety, what medicines do you suggest? Great. It depends on, so whoever has irritable bowel syndrome, right? People have irritable bowel syndrome, you get anxiety, and a lot of people get diarrhea. So my recommendation is Linzess, which is a prescription medication from your doctor. It's safe. It's specific for IBS with diarrhea. If not, then Imodium is good. But remember, there's two types of IBS. You have constipation type and diarrhea type. Which one are you? And if you're the diarrhea type, Imodium, fiber, and then Linzess helps. If you're the constipation type, Linzess helps. But then taking a stool softener with you, not a laxative, because you may have to use the bathroom and you get explosive diarrhea. You don't want to do that. So take a stool softener with you that'll help you move your bowels. Okay. Should we take all the vaccines you guys mentioned earlier? No, I mean, we recommend the flu one and the pneumonia one and the meningitis one. Those are the three. I would space them out. Okay, don't get all three at one shot. Maybe get one. today, get the other one in a week, get the other one in another week. You don't want to have this immune flux in your body, in your system, causing you other problems. If you have to and there's no other choice, okay. But there's a risk with that, getting sick and whatnot. Can I use a mask? There's a difference of opinion about the mask. It depends if it's a medical necessity or not. If you're sick, and because you're sick and you're coughing and you're congested, you're going to get other people sick, we recommend a mask, but then paying a little bit of charity. Okay. If you're doing it just to prevent yourself from getting sick, this is a difference of opinion, because the Prophet ﷺ mentioned a hadith: do not cover your face, when it comes to ihram. It's something touching your face. So different scholars have difference of opinion. Does it break your Hajj? No. Do you have to pay a charity? Yes. Is it a personal preference, personal choice? We recommend, again, if it's a medical reason, talk to us about it. There's no general blanket statement. We can't just say, yes, wear a mask. No, it depends on the situation, depends on the scenario. During ihram, outside of ihram, wear a mask. Wear a mask all you want. Wear 2 masks, 3 masks, 4 masks. Wear as many masks as you want. But during ihram is when we're talking about, that's the nuance, that's the nukta. It varies. Talk to your local scholar, talk to your what madhab you follow, and what would be the penalty that you the charity that you may. I don't. Some people got offended when you say penalty. What charity you have to pay for it? Everything has a sacrifice that you have to do when it comes to Hajj. How many people in each group? They will give us any kind of ID. Yes, you're gonna get an ID, but that's Harun's question. Go ahead, Harun.
So, for each group, expect approximately between 40 to 50 people, and you will be getting a Nuzuk ID, which is a very important part of it. And just to connect it with today's seminar, now when you go to see those doctors in Mina, they scan your Nuzuk ID. They don't ask for the visa. They don't ask for the passport. They scan the Nuzuk ID. They pull up all the information. As we have been advising on filling out that form, if you have any chronic diseases or anything like that, all that information pulls up. So I'm just going to use myself as an example. I'm a diabetic. So when I go to the clinic, before they do any treatment, first thing they do is they check how much where my sugar levels are before they do anything. That's a part of their checkup. So they do follow those precautions. So when you did the Nuzuk application to do the verification, they had that whole medical portion. I hope you were able to fill out all the information in there, and that information can be utilized. So yes, the Nuzuk ID is there, and I'm gonna let Dr. Bukhari take over again, inshallah.
When it comes to panic attacks, I get it. Uh, there are anti-anxiety panic attack medications that you can get from your doctor that are as needed. Okay, my opinion, in Hajj time, if this is a serious issue, Xanax temporarily is a good fix. Buspar or hydroxyzine, some of these medications, if you have really bad panic attacks, talk to your doctor and see if you can get just a few days worth of medication to help you through the Hajj process. Okay. Otherwise, there are exercises that you can start doing now to help prepare for panic attacks. Just Google it, chat GPT it. There's a different types of exercises you can do to help for panic attacks. Start doing those exercises now. Breathing techniques, meditation, cognitive behavior therapy by seeing a therapist, or just, you can do it online. Just do 1 or 2 sessions. This can help, okay? But panic attacks are real, and my advice is, because it's Hajj, it's once in a lifetime opportunity. Just talk to your doctor, get some Xanax, get some hydroxyzine, get some Buspar, something that'll temporarily help you, a few pills through this Hajj journey. Any suggestions for a person that gets UTIs? UTI, urinary tract infections. Yes. Number 1, don't hold your urine. That's one of the most common ways to get an infection. Number 2, keep yourself hydrated. Number 3, avoid high sugary drinks, high caffeinated drinks. Number 4, make sure you have Cipro with you. Cipro or Keflex are the 2 medications to help with UTIs. Cipro or Keflex. And this will be recorded. You can go back and listen to it. These are medications that can help fight UTIs. Those are the main things, okay, when it comes to UTIs: holding your urine, not getting hydrated enough, and drinking too many sugary drinks, too many caffeinated, sugary, caffeine related drinks. That's what usually cause UTIs in people. 3 years before I do a vacation for Umrah. Now I need again. Yeah, we all need it, brother, sister. Sunglasses, are they fine in Ihram? Yes, they are okay in Ihram. Do hotels have fridges to store the insulin? Yes, they do. Where can I get the form from? Harun, we'll let you guys know. Which form are we talking about?
I
If
want to
it's a
touch on
medical
the Nuzuk
form,
ID again. I see one question
yeah.
on that. So the Nuzuk ID, you will receive that in Saudi. This is one of the things that are under the responsibility of the ITRA team. And the form is when you are applying for your Nuzuk account on the Nuzuk Hajj site, which we have been guiding since the beginning of the year. So in there, they have a whole section for chronic diseases and stuff like that.
So a question, please, Sister Farzana, can you specify which form? Are you talking about a medical form or you're talking about Harun Hajj related form? Also, medical form to fill out if someone has medical condition. Oh, what kind of form? Just any letter, professional letter on a letterhead from the doctor or the hospital that just lists it out. Okay, um, something professional. It doesn't. There's no form. It's just a professional letter or a medical documentation from the hospital, from the clinic, something that is professional and official. And my other recommendation is make sure you have a signature on it or a stamp on it, because I don't know, for some reason Saudis are huge about there's no official stamp, there's no official signature.
I completely agree with that. I was picking up my vaccine record for meningitis just 2 days ago, and the doctor's office gave me the letter. It has a letterhead and everything, as it mentions meningitis on it. And I told them, I was like, "Do you guys have a stamp?" And they're like, "Yes." I'm like, "Stamp it and sign it." It doesn't matter who's signing it, but they respect stamps as if it's like the final authority.
That's the culture, it's their culture, that's how it is over there. So make sure whatever medical document you have, there's a stamp or a sign on it. It doesn't even matter where the stamp or sign is from. Okay, question. What if you do muscular training and you want to train your legs? The best form of training for your legs is squats, stairs, ellipticals, and biking. Okay, and then obviously walking. Okay, walking, obviously walking. But if you're trying to do more strengthening and you're like, okay, I have some time, what do I mean by squats? Literally, you stand and then you bend down. If you have some weights, that's good. But if you don't have weights, that's fine. You just squat your legs, your knees, you bend down, and then you go up. You bend down, you go up. 3 sets of 10. That's enough. Every day, every other day, that's enough. You'll be very strong by the time Hajj is coming around. So I hope I answered that question, because it's not clear. If you're someone who does muscular training, is it best to avoid working out the legs to help keep them strong during Hajj? You want to maintain that strength. If you're a muscular trainer, maintaining that strength. So how do you maintain strength? It's not about the weights, but it's about the repetitions, right? Keeping consistent. So you want to avoid doing heavy weights and just keep doing the repetitions, the actual motion. And that's how you maintain it if you're a muscular trainer. You don't want to bulk up. I agree with you. Can I get a vaccine from the pharmacist? If the pharmacist has the vaccine, yes, because some pharmacies do. But most of the time, you may have to go to the health department, your local health department. You have to Google this, search it, find out their hours, make an appointment, or go in, ask them when they are open and when you can get the vaccine. Or you can ask
Dr.
your
Bukhari, in New York, I'm talking specifically in the tri-state area. It's a little bit different over here. Getting the meningitis vaccine is very easy. You can go walk into Walgreens, you can walk into CVS, and they'll give it to you, and they'll give you the record on the spot as well.
Yeah, exactly. It depends on where you are and the pharmacy that's local near you, what they have available. So call, ask them, do you have the meningitis? Do you have the pneumonia? Do you have the flu vaccine? Simple. That's it. It depends on your location, depends on your primary care physician, and it depends on your local health department. Those are the three places you're gonna get it.
And most PCPs they have meningitis vaccine. Call in advance, and they'll let you know whether they can do it for you or not. I don't think it's not usually covered by insurance, but some of the clinics, the PCP is the place where most likely you will get it covered somehow. So, but in most cases, it's not covered when you go get it. And this is about approximately, I think, like around $100 to $200 expense to get the meningitis vaccine.
Yeah, guys, listen. Don't be nickel and diming a vaccine because of money. You're already paying thousands of dollars for Hajj and you're trying to get there without any issues. It's okay. What about the flu and pneumonia vaccines? Are they a must or just if we want to? It's okay. If you don't want to get the flu and pneumonia vaccine for whatever reason, it's okay. But if you have medical problems, you have chronic conditions, you get sick easily, okay, you should get them. This is a recommendation. This is advice, especially to help from COVID, flu. The flu vaccine helps for COVID, okay? So pneumonia is real. People do get sick. So you have lung disease, you have diabetes, you have immune weakness, whatever, you have a chronic condition, okay? You want to make sure that you want to get these vaccines because they will help. Okay, now if you have a side effect from it, you have a personal religious preference, you just don't believe in vaccines, okay, fine. But just be careful, be wise. They may ask you for it, okay? Because they're recommending these vaccines on the Hajj Ministry website. But are they a must? I mean, people get away with it all the time, you know.
Can I take the next question, Dr. Bukhari?
Of course.
For only record that you actually need is for the meningitis vaccine. Please keep that in mind. If you don't have a record for the meningitis vaccine, you may get some issues when you arrive in Saudi. The Ministry of Health employees are at the airport, and their sole job is just to stop you, see where you're coming from, and see whether you have the vaccines they have required. Because for us coming from the US, our only required vaccine is meningitis. But from other places, they're required to take yellow fever. They're required to show polio vaccine. They're required to show other things because those issues happen in those countries. So for us going from the US, meningitis is the only one that you actually need to have the record for. The meningitis, I believe, Dr. Bukhari, it's not a yearly vaccine. I think it's like every 3 to 5 years.
Every 5 years, yeah, every 5 years. It's effective every 5 years. After 5 years, the efficacy goes down. You lose the benefit of it. Exactly what Harun said. Meningitis record is the only thing you have to have with you. Have a paper form and have it on your phone. The other vaccines, they don't need a record for it, but it's wise to have it with you and your immunization record on the phone or a copy of it. Okay, it's not like it's not like
It's highly recommended to have both, just in case you're not able to pull it up on your phone. And just in case you lose the paper copy, you have it on your phone. And as we advised in the earlier session we had for the checklist, alongside with your visa, your documents, and one of the major things that I covered was the meningitis vaccine record. This is a must. Back in the days, I don't know if you remember this, Dr. Bukhari, they would not even issue the visa without the meningitis vaccine record.
yes,
They will
yes.
not even let you get on the flight. They were deboarding people on the flights. They will refuse boarding for people. They will not print out the boarding pass if you did not show them your meningitis vaccine record. Now the rules have relaxed a little bit, but you need it to show in Saudi, and of course for your own health as well too. There's a risk for this. That's why this is something that is required from the Ministry of Health in Saudi for Hajj pilgrims.
Yeah, you guys understand, right? Meningitis, brain infection, the meninges, this is the most common cause of it is being around a lot of people. So that's why it's a big health hazard, big health risk. One person gets it, you can spread it to other people. It's very contagious. That's the problem. It's very contagious. That's why in the In medicine, if you are exposed to someone with meningitis, you have to be treated even if you don't have the symptoms.
I think the questions are done, and it's almost time for Maghrib as well too here in New York. If you would like to do your closing remarks, Dr. Bukhari, and then inshallah we can end the meeting.
Okay, Jazakallah khair. Everybody, it's an honor and pleasure to have been here with you all. I hope this was beneficial. Please let us know and give us feedback so we can always, improve ourselves. And then just remember what we mentioned before and what Harun has been mentioning and the lecturers have been mentioning throughout these series. Hajj is a once in a lifetime opportunity. If you have been approved and verified to go to Hajj, this is an invitation from Allah subhanahu wa ta'ala. You are being invited by Allah. Do not take it for granted. Times are changing, rules are changing, the world is changing. This opportunity may not come again. Take advantage. And how do you take advantage? Be sincere. How do you be sincere? Prepare for it. Prepare for this mentally, emotionally, physically, spiritually. You have to prepare for it. Okay? And you have to understand that when a Hajj is accepted by Allah, there is no reward but Jannah. There is no reward that Allah can give except Jannah. So please do not take this for granted. Please prepare yourself. Please be sincere. Please clean your heart. Please clean your hearts and make dua to Allah subhanahu wa ta'ala that He accepts this from us. Jazakumullah khair. May Allah reward you all. May Allah accept from all of us. And we are here for you. And there's anything that you all need, any questions, any concerns, text us, email us. I mean, we pretty much have a text group right on Telegram or wherever the organizers are gonna allow us to communicate with each other. And may Allah bless you all. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair, Dr. Bukhari, for doing this session today. A lot of information was provided today, and it's not easy to retain all of it. So, inshallah, recording will be available for you to go and rewatch this and share it with others, so they may also benefit from this. And we will continue with our series. This is the last session we have for our sessions for the preparations. The next sessions we will be going over will be purely logistics, and it will be like basically giving you a whole story from leaving your home to getting to Saudi, to doing everything over there and coming back, so you have a understanding of the logistical portion of Hajj too. So we will be mentally preparing you. We will be trying to get you in that kind of in that mode where you understand what is there to come and what's going to happen. And a lot of these things, these Nuzuk IDs and some of these questions that are coming up, that is a deep dive. And it will be going in order. So if you're not able to attend, please do watch the recording for the previous sessions before you attend the next one, because it will be building on top of each other. And we're expecting these sessions to be a total of anywhere from 10 to 15 hours for the next series to fully prepare you for this upcoming Hajj journey and what to expect for it. Jazakallah khair for joining us today. And till our next session, Assalamu alaikum wa rahmatullahi wa barakatuh.